This young boy of age 15 years presented with us with multiple pus discharging opening around the sacrococcygeal region. As you can see, midline pits, two lateral openings, and on instilling methylene blue from one of the opening, it is coming out from the other two, indicating the three being connected with each other. So we perform what is called as a laser pilonidal sinotomy. Now, many studies have concluded that simpler treatment methods for pilonidal disease carry less morbidity and a low recurrence rate. As the procedure of sinus excision by laser aims at removal of the sinuses alone while causing little damage to the surrounding healthy tissue, it can be termed as a simple and minimally invasive technique. Pilonidal sinus disease consists of complex symptoms with presentation ranging from asymptomatic pits to painful draining lesions that are predominantly located in the sacrococcygeal region. Non-operative measures like simple shaving or injection of phenol in the tract may control symptoms without surgical intervention in a self-limiting disease. However, a high recurrence and failure rate of as much as 30% has been reported with such approaches. A lay open method is another minimally invasive technique which can be done on outpatient basis and having a low recurrence rate. It, however, is associated with slow healing. The laser sinus excision takes a wider skin incision and creates a funnel-shaped wound without removal of the overlying skin. With this maneuver, there is hardly any chance of leaving behind any inflammatory tissue or part of the sinus tract behind. This also prevents forming a dead space under the skin in the early post-operative period, particularly when the buttocks come closer. The operative time for laser sinus excision is significantly shorter when compared with other technique. This is possible because while excising the sinus and offending tissues, the electrode of the device provide a coagulative effect, obviating the need to secure bleeding points. Laser has been shown to achieve sealing of sensory nerve endings and the leaking lymphatics, the two factors which are supposed to cause post-operative pain and edema. Due to minimal pain and insignificant discomfort, the patient operated with laser need lesser quantity of analgesics. The patient operated with this procedure are able to return home within 12 hours of the procedure, while the mean duration of hospital stay in other approaches are significantly longer. The patients operated by other techniques prefer to stay in the hospital due to pain, a large wound, and need for dressing under supervision of a nurse. Negligible pain, comfort in performing routine activity, and absence of specific wound care can encourage the patient from the laser sinus excision to group to resume duties early. The wound created with laser heal significantly faster than the other ways of treating this disease. This is possible due to a significantly smaller wound created by laser with a minimal lateral thermal damage. This is evident with a significantly lesser need to change the dressing of the wound in the hospital. Similarly, wound-related complications like secondary infection and non-healing are not observed with laser procedure. So once the entire tract has been laid open, the wound edges are refashioned, especially around the opening, as well as any dog ear flap needs to be removed to unroof the underlying tissue, allowing a faster wound healing. The wound is cared by regular wash with soap and warm water, application of a antiseptic cream and keeping an absorbent pad over this. The wound is inspected every fortnightly or monthly as per patient's preference and watched for any wound related complications.